Hello, Dr. Ladeb again here. I'm here to talk about hepatitis. I know that lots of you have been waiting to get to this point in the course that talks about hepatitis. What is hepatitis? Uh, itis in medicine means inflammation. And inflammation is just a terminology that is described by five factors. Some of the most important is the fact that the organ that is inflamed cannot perform the function it normally would perform. It is normally red, and there is a bit of warmth to it, and several other parts. Now, hepatitis means it's just liver. So inflammation of the liver is a terminology that is given to talk about the liver is just not able to do what it would normally do. And it's actually a big spectrum spanning from just able to do some functions or even full functions to not doing anything, complete failure. And that gives us a room for a bit of confusion because some people you see them moving around, they have hepatitis, but they don't feel sick. And then whereas others have hepatitis and they are actually dying. And so it's quite confusing sometimes. And it is not unusual to hear people say he died of hepatitis. And then when somebody has hepatitis that is quiescent, they start panicking because they believe they're also going to die. And so this is quite concerning and confusing. There are many causes of hepatitis. It's not only viruses that cause them. It can be caused by drugs. It can be caused by infections, viruses, bacteria, fungi. It can also be a result of toxins or even some food that we eat, like such as mushrooms. Some drugs that we take commonly, like methotrexate and azathioprine, and even paracetamol, as innocent as it looks, can cause a massive necrosis or damage of the liver in hepatitis. Now, hepatitis is classified into two forms. There is acute hepatitis and there's chronic hepatitis. The terminologies acute versus chronic do not represent the severity. It's actually time bound. In other words, if the inflammatory process of the liver lasts less than 6 months, it is termed acute hepatitis. Whereas if it lasts longer than that, then it is termed chronic hepatitis. Okay? So those are the simple definitions of what hepatitis is. Stay on there and join me in the next lecture so that you can understand what that means and how we can differentiate between two of them and how the outlook would be like before we get into the real aspect of hepatitis B. Thank you, and we'll be there to welcome you again on the next lecture. Bye-bye.